I felt like it should have been the happiest time of my life, especially considering what we went through.
That's Ashley Pauline. We introduced you to her and her husband Matt 1 year ago after the birth of their premature twins Madison and Landon. After surviving months of worry and travel back and forth to Lehigh Valley Hospital's Cedar Crest NICU unit in Allentown, she thought the worst was over until she found herself in a new battle with postpartum depression.
So Landon came home in February, right around Super Bowl. And honestly, that night, I swear it was like a switch. And I recall women talking about it and saying, if you feel any type of anxiety or any type of sadness or any type of mood swings, talk about it. And I remember having a conversation with my husband just because we had such a long journey going through this. And I said, be mindful. I will as well. And let me know if there's anything that seems off. And from that day on, I began, I would say, the biggest struggle of my life. I always say my kids fought for their life and I fought for mine because postpartum depression was something that I could have never imagined, that I read about, I heard people talking about it, but I didn't think it would happen. I didn't think it would actually happen to me. And it did. I felt like it should have been the happiest time of my life, especially considering what we went through. And I couldn't understand as a mom why I was feeling such sadness and such anxiety and such dread to kind of face the days. And I couldn't understand. I couldn't put my feelings into words. I felt no ambition to do anything, no happiness. And I was looking at my son who was home and my daughter, we would still go to visit her in Allentown and take my son with us. And everything I wanted was right in front of my face. And I couldn't find the happiness. I couldn't find it. And I was reaching out to so many people trying to figure out how and how to get through it. And I felt like people, even though it's mentioned, we hear about it, it's not talked about enough because people are ashamed.
So you were dealing with the world on your shoulders, but you found someone to help you. So tell us about that.
I did. So throughout my struggles, I became friends with a lot of the NICU nurses. And one of them had suggested to me the WAVES program through Lehigh Valley. And through that program, I met Melissa, who is a physician's assistant who easily became, I mean, just, I want to say savior. I know that sounds horrible, but she just was everything that I needed. Along with a lot of other things, I did counseling, a lot of therapy, a lot of medication, a lot of different things, but she was always there. And this program to me was such an outlet. And I think everybody has to be aware of it, that it's out there and that help is there, even though it seems like it's not.
I'm very pleased to be joined right now by Melissa Aylesworth, a certified physician assistant with the Lehigh Valley Physician Group OBGYN. Melissa, thank you so much for being here today. I guess let's start at the beginning for people who may not be familiar with what it is. What exactly is postpartum depression?
Postpartum depression, or as we in the medical community refer to it as perinatal mood and anxiety disorders. These are conditions that affect mom's mental well-being during pregnancy and then postpartum within 12 months of giving birth. This can compose traditional depression, anxiety, other non-specific mood disorders, and it can really look a little bit different for everyone.
Is there still, like, I don't want to say the word stigma, but is that what you use associated with it? Or are people now more understanding of what it is?
I think yes to both of those things. So there definitely still, unfortunately, is a stigma. And a lot of times we find that the moms put that stigma on themselves, and they can be the hardest on themselves, putting pressure on themselves to be perfect, think I should be this way, I should feel better, I should be like this. But really, it is nice to see that we are starting to move in a direction where people are starting to acknowledge and talk about mental health and start to ask for help whenever they need it, check in with their friends, and talk a little bit more openly about this. We still have a long ways to go, however.
Is this like a common problem for a lot of new moms?
It is. The statistic is 1 in 5. So 20% of women, give or take, can experience a mood or anxiety disorder during pregnancy or in the postpartum time period. It is the most common pregnancy-related complication, more prevalent than things like gestational diabetes, preeclampsia. And the studies have shown that the vast majority of these patients don't seek help or don't get appropriate treatment.
How do you know if you are dealing with PPD?
Some people may experience more anxiety, more perfectionistic tendencies. I need to check in, constantly worried that something's going to happen. Some people may find that they're more irritable with their loved ones. Some people may find that they just aren't experiencing the joys in life, the pleasures in life. Some people may be experiencing crying or mood lability, so swings in moods, things like that. So if anyone notices that they are really just deviating from their norm and not feeling like themselves, and it's impacting their life, their ability to function, their self-esteem, that's really when they should be reaching out for help.
And where is the best place to turn for help?
I will put in our little plug for the WAVES program that we started with Lehigh Valley Health Network. WAVES stands for Women Adjusting to Various Emotional States. It's a program that a few of us that are passionate about perinatal mental health in the obstetrics and gynecology community started last year. We've seen over 600 women from the Lehigh Valley and the Pocono area since that time. And you can find us by reaching out to your Lehigh Valley Physician Group obstetrics and gynecology provider. You can call any Lehigh Valley Physician Group obstetrics and gynecology office and ask about the WAVES program. There is help outside of LVHN as well. Postpartum Support International is an amazing organization. You can go to postpartum.net to find their helpline numbers, support groups, things like that. And then if you find yourself really in crisis, 988 is the newer, easy to use suicide crisis line. They have 24/7 people on standby, providers that speak both English and Spanish and are available to help.